Good morning, everyone. Like she said, my name is Dr. Asia Harris, and I'm a family medicine doctor in Flint, Michigan. Every day, I see how the environment around us directly impacts the health of my patients. I'm here today because the decisions made in Michigan by our legislators can either protect or endanger the well being of families across our state. When we talk about health, too often the conversation stops at hospitals, clinics, and prescriptions. But health begins long before my patients walk through my office doors. It begins with the air we breathe, the energy that heats our homes, the buses that carry people to work, and the opportunities we create to share resources across our communities. That's why I'm urging our legislators to support community solar, public transportation, and affordable and dependable energy in Michigan. These are not just environmental policies, they are health policies. Too many families in Michigan could not afford to install rooftop solar panels, even though clean renewable energy would save them money and reduce pollution. Community solar projects allow neighbors to share in local solar farms, cutting energy bills and reducing the burning of coal and gas. Less pollution means fewer people with asthma, fewer heart attacks, and fewer premature deaths. For children in Flint, Detroit, and across Michigan, it means being able to run and play without gasping for air. Dependable buses and safe routes are more than convenience. They are lifelines. When people have reliable transportation, they can get to work, to school, and yes, to their doctor's appointments. Lack of transportation is one of the most common reasons patients miss checkups and medications. Strong public transit reduces car dependence, which also cuts air pollution and traffic injuries. 92% of Michiganders agree fossil fuels harm air quality, and over 1 in 3 households report related health problems from poor air quality. Replacing dirty fuels like coal with clean, reliable energy will protect public health and ensure our children grow up breathing cleaner air. Michigan's asthma rate is 10% higher than the national average, with children, seniors, and low-income communities most at risk. A healthier, more connected Michigan is possible when people can move safely and affordably. In Michigan, winters are harsh, summers are getting hotter, and too many households face shutoffs or unaffordable bills. Our Michigan energy infrastructure needs work. We need affordable and dependable energy. Clean energy laws would rejuvenate cities. When families can't keep heat on, children and seniors suffer. When power outages drag on for days, people dependent on medical equipment are put in danger. Hospitals are stressed in emergency rooms as they face electrical emergencies due to an increased influx of patients during power outages. Reliable and affordable energy is not a luxury, it's a basic health need. By investing, By investing in resilient and renewable energy, we can protect vulnerable residents and save lives by lowering costs for everyone. And I want to be clear, these are not abstract policy debates. These decisions mean the difference between whether an elderly patient of mine ends up in a hospital from heat stroke during a blackout or whether she stays safe at home. They mean whether a child grows up with healthy lungs or whether he carries an inhaler for the rest of his life. They mean whether families in Flint and beyond will continue to pay the price of environmental neglect or whether they will finally be able to given a chance to thrive. Legislators have a responsibility and the opportunity to act. Supporting community solar, expanding public transportation, and ensuring affordable and dependable energy will not only strengthen our economy, but it will save lives. As a doctor, my oath is to protect health. As lawmakers, their oath should be to protect the people of Michigan. Let's stand together and invest in solutions that keep our communities healthy, resilient, and strong. Thank you.
Make some noise for Dr. Harris.